Terry and I have been watching, obviously, what's going on in Minneapolis.
I think we all are.
Yeah, and
Today seems
we've kind of, we met today
okay.
to kind of go over how we're gonna, she's gonna do some of them, I'm gonna do some of them, and hopefully in a period of 15, 20 minutes at most, we can cover
Okay.
everything
All the
that we think
legislative
is
updates.
relevant
Okay.
in the legislature.
Got it.
Really? Very well. Right? New Fallujah.
Is Michelle coming? Okay, then I'll wait for her. Give her a minute or two. Yes, I'm just gonna give Miss Cherry one or two more minutes and then I'll start. Thank you. So many roads are closed and blocked off.
Oh,
I still don't have power.
You're kidding.
Terry doesn't even
Yes.
trying to get this. I was like,
You know, my power went out for about 20 seconds.
oh my goodness.
We don't have a tree down.
We were out 26 hours.
You telling me you've got a,
yeah.
you're,
I'm not a kid.
well, you know, if you live right, good Lord takes
Sorry,
care.
Mom.
I'll tell you, I said a long, hard prayer, and about hour and a half, 2 hours later, our electric came.
Well, yeah, you were saying how
No,
it's raining
but-
too.
Yes.
It rained
Plus
hard by us,
sideways.
but not
But next week,
crazy.
The trees, they didn't fall from the roots.
that's why I'm like, I feel bad.
My place, they just wet like they were top.
Huh.
Just came through, and they're big oak.
We're actually
Obviously.
And
I need to get up.
over
Longer
100
than
years.
you and I
Oh,
put
God,
together.
Thinking about it. Although it looks like rain. That's my love.
That's a nice book.
Oh yeah, at least it'll be
Well, now we got to use them.
Yeah.
You don't do any good sitting in the
No, no,
yeah. There's storms.
gotta told her.
You know, I've told you, to,
I'm just waiting. I don't.
you were so appreciated
I went away.
when you were on the council for your support.
No. All right.
Thank
I'll go ahead and start.
And you were there.
All right. If we can please stand for the pledge.
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all for joining us. Michelle is to be here soon, and Terry is out today. She has no power in her house still. I don't have power in my house yet either. So pray for the NIPSCO and tree people for all the hard work that they do. Thank you for all of our guests who are here today. And if we can have a motion to approve the minutes from the last meeting.
Motion to approve.
Second.
Great.
Okay. Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osana.
Yes.
Thank you. Our next board meeting is scheduled for May 6th. By then, the finalized state budgets should be given to us, so we'll have a little more knowledge of what's coming forward towards us from the state. We do have a quorum, so I'm going to keep going on. I know Michelle's going to join us. There she is. You did it just in time. What happens? You're good. You're good. So I'm going to move on with new business. We have a few proposals coming at us today. First one is HFI funding proposal from the Valparaiso YMCA. If you can join us at these. Fine. Thank you for joining us. Thank you.
You can go ahead and start.
Mhm.
Good afternoon. I'm Wendy Burbridge, Director of Development, and this is Elise Komenankis, Wellness Director, and we represent the Valparaiso Family YMCA. Our proposal expanding accessible wellness opportunities in Couts and Hebron directly aligns with the 2025 KPI set by the Porter County Health Department, aiming to reduce adult obesity rate among residents age 20 plus from 42.6% to 40.3% by 2028. Specifically, we will address health disparities in rural Couts and Hebron by providing accessible weekly fitness classes such as chair yoga, senior strength training, and cardio dance. Partnering with Porter County Public Library, our certified and CPR trained instructors will deliver engaging classes using mobile fitness equipment funded through this grant. We will evaluate the program's effectiveness through attendance records, participant feedback, and health outcomes. Our requested $7,150 grant supports essential equipment, instructor compensation, targeted marketing, and contingency planning. Long-term sustainability will be ensured through diversified funding and local instructor training. We welcome any questions.
Thank you. Just to start, I don't remember if you were with us when we started the whole wellness proposal. I know Sylvia, you haven't, but we've launched an initiative. One of our 4 main metrics that we want to work on with our HFI funding is to bring down the obesity rates in our county. Our state ranks horribly. Our county isn't great. And so that is one of the things we wanted to focus our attention. Commissioner Regnitz had initiated this POCO wellness program for all of the county employees to get them involved with incentive programs and different modalities of health and well-being. And so we kind of took that kind of model and wanted to extrapolate that out to the county. And so with that, we put out an RFA for community members to come to us with programs that we can help assist with to get out to the community, to get them moving at the end of the day, just to help combat the obesity. So I don't remember if you were here when we voted for all of that or if that was after you in my mind. I know you were after. Just so these are the programs that are coming to us because we put that RFA out.
There is a scoring rubric, and that's, you see that in front of you. That's one of the things that I put in front of you. And I just gave one sheet. We're going to hear both proposals. Yes, but it's the one without the right at the top of it. So if you want to repeat that as you guys are discussing and looking to see those programs.
I don't know if I have that, but
Okay, sorry.
pass it one. Oh, okay. Very good.
Shannon gave us.
I like this. All right, so that's kind of where we're at. One of the target areas we have been speaking about for as long as I've been part of the health department are these areas like Couts and Hebron that really tend to not get all the services that our bigger cities in our county have. So I personally was very excited for this to see this come across our way to somewhat address underserved areas, which I would say that they are, and to see you guys from the Valpo Y to expand out that way and reach out to that population, I think is very exciting.
From this proposal, it says from May to December. So this would begin in May of 2025 to December of 20.
We'd actually contacted the library, the Porter County Library, and they were ready to go in June. So that is an adjustment. June to December. Yes.
6 months.
Yes.
And this would be the cost for 6 months.
Yes. So the breakdown you see.
What is the anticipated number of participants?
It's hard to say. We haven't made an effort like this, a mobile effort like this, so it's hard to say. I can tell you anecdotally that the library is really excited about partnering and about this opportunity. I also reached out to the chambers or the contact people for the chambers. Not all are still functioning right now, but they were also welcoming that opportunity. So I think there's a need or an interest. I really, it's hard without doing a marketing.
Oh, yeah.
Well, and you have a robust about. I like to see that you guys are kind of taking the marketing seriously and kind of reaching out to this community, so that I think one of the struggles we have with everything that we do is getting the word out and letting our community know of all the wonderful services that we have available to us in Porter County. So I've yet to find what the magic is to get that that fix.
Marketing is really difficult to
Yeah.
find the magic. That magic.
Yes.
Yeah.
You
can only try. And so the plan was to notify as many households as that we could do affordably. So that's why we chose postcards and a specific, within the community. We're not going to do everybody, but a certain household by age. So the best we can do as far as demographics to let them know, but also the library was very willing to help support and do outreach with us. And the fact that we have social media, we're going to be getting the word out about it as well. So word of mouth will help, but it's always marketing is always a challenge.
I will say that our partners at Purdue Extension just did an outreach. One of our programs about balance.
Yeah.
In South County, and now she has a cab that she can have on her class, and she filled the class. And
that makes me feel so good. Yeah.
Wanted to point that out. So
Right.
I think this is an area that's craving for more services to reach out to them from what we've
up in our assessment. So
Yes.
I would like to say this is a great idea, and I thank you ladies for being here today. My only question would be, do you guys have room to make sure that the Board of Health is acknowledged within the advertising and perfect?
Absolutely. That wouldn't be challenge. We'd want to make sure to include the Board of Health as well.
Perfect.
I think that's important, and it just legitimizes us even more.
I think one of the things that we're trying to accomplish is we have a website called Find Help, and we were hoping that potentially you might use this as a platform to also advertise that as well for us.
Oh, wonderful.
Perfect.
So the classes are free initially. Are you guys looking to maybe, like, as time goes on, if this is successful in like the upcoming year, to maybe make it where it's actually making some money so that you might not need to get as much funding from us?
Yes. Yeah. And so I know, and I can't remember the page, but I do mention that we would discuss, based on the feedback, whether it would be on a sliding scale, just to make it, us able to continue. But I'd also be reaching out to business owners. There's different ways to look for funding to help make it affordable. I mean, as director of development, that's my role, is to continue to make all of our services affordable for everyone in the community. So I would identify those opportunities to continue that even in Hebron and Couts.
I think this is a great idea too. Have you reached out to the town councils?
I have, and
I think I would suggest that you may have a little presentation to each of the towns, and to get the word out as broadly as you can.
we'll definitely do
People
that.
so excited they can't wait for you to open the door.
Yeah, you can't have too many advocates, cheerleaders in a community. So
And all the community partnerships just, I think, makes us all stronger working together.
yes.
Well, if there's no more questions, I will put a motion for us to vote upon. A motion to approve the HFI funding proposal of the Valparaiso YMCA Expanding Fitness Program. We need a second, if any.
Motion.
Second.
Thank you.
Okay. Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Michelle,
yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osana.
Yes.
Thank you.
Thank you.
We look forward to it being together and hearing updates. We love hearing updates.
We'll make sure to have that happen.
Yes. Thank you.
Thank you.
Next up, we have the Portage YMCA. Shannon's joining. Thank you for coming back. I've said this about Sam before. Shannon is another one that everyone should know. She does so much in this community with the Portage YMCA, helping the homeless, small business owner, all of these things. So I find it very exciting to have the opportunity for all of us to work together and witness the hard work.
Thank you. All right. So I am Shannon Burhans. I'm the CEO for the Portage YMCA. So I had the pleasure of being here last year
Yes.
to ask for some funding. So I did put a kind of a recap of all of the fun things that we've done over the past year. A lot of outreach events. We did over 15, doing lots of education, blood pressure checks, diabetes screenings, fit checks, body scans. We have kind of blown it up on social media. We did several social media posts. We did direct mailing, thanks to this grant for WISE. That's not really normally in our wheelhouse, not in our budget to kind of do direct mail pieces, but we were able to partner with the chamber this year. They did a magazine that went out to over 18,000 households. So all of our chronic disease prevention programs were in there, and management programs that the health department mentioned in that as well. Email marketing campaigns. We did direct outreach. So we have a lovely retired man who does some outreach for us, and we send him out once a week. He visits doctors' offices.
Was it on?
Yeah, he's been to your office. So he goes out working on referrals, making sure that we're getting the word out, that doctors know we're there for support. We know your time is very valuable and don't get to spend as much time with your patients as we get to when we get to see them daily. So encouraging those referrals. We did 109 businesses this year, some senior living communities as well. So lots of outreach, trying to get referrals and just more exposure to the programs that are available to help manage chronic disease. We did health screenings, wellness programs. All of those screenings led to 88 people deciding to take a next step in the journey. And that was what we could absolutely track. Obviously, our hope is through the education and through doctors or other referral services that they found other ways to continue their journey as well. But we have 88 people who have made a choice because of those outreach efforts. We also created 8 engagement opportunities for our seniors to foster social connections and improve their well-being. Our senior population is still definitely our most involved. We find that they are more willing to make positive changes, and so we definitely see a bigger return on our investment when we're making intentional events for them. So overall, between marketing and all of that, we project that we reached over 32,000 people this past year. So and then for this year, obviously we want to expand the programs that we're currently doing. We saw especially in our blood pressure self-monitoring program, that's definitely our biggest challenge. High blood pressure seems to be so mainstream. It's very, very difficult to get somebody to make a decision to make a change in their health. The diabetes prevention program, super easy. The minute somebody sees that they're pre-diabetic, they don't want that next diagnosis. So we were able to get them connected, and they're very, very willing to make a change there. So for our blood pressure self-monitoring, we have been consulting with other WISE across the nation and have found that they're seeing a lot more success by doing seminars. So we have 4 seminars on our radar to start ASAP. The DASH diet, there's one cooking, one just kind of helping them read labels and understand, and then lowering their sodium. So that's our plan for blood pressure. Um, we want to introduce a new evidence-based program this year, which is Healthy Weight in Your Child. So this is really kind of tackling that obesity issue at a family level. This is a program that we have access through our Y World, and of course we're well positioned to deliver that one because we do see a lot of kids, and then being able to pull in the families as a unit there. Part of our expanding the family-based approach for obesity is besides Healthy Weight in Your Child is our family physical activity nights. So one of the things that we launched this year, we introduced our elementary school age kids to pickleball. And so we have now our youth starting to play. We have our adults that are playing, but what we'd like to do is kind of merge those two and create some more family opportunities. It's a fun way to play, gets people active and moving, and hopefully they just think it's fun. And meanwhile, we're creating some positive impact there. Lots of other ideas for that piece of it, but then we'll move into the nutrition education, healthy eating workshops, cooking classes. We started to launch a food is medicine program this year that was specifically for a separate initiative working with prenatal families. So we have a couple under our belt right now, working on really kind of expanding that out to the whole family unit as well. And then family engagement, community garden, parent workshops, family meal nights, and wellness challenges are our targets there. And then school-based interventions. So healthy snack policies. We do this every day after school anyway. We have a 5-component meal that we serve to our kids, but really kind of strengthening our partnership with the school to make sure that we are mirroring the healthy snack policies as well. We are looking into a walking school bus initiative. So just really kind of getting some communities together that can have a few days where they're guided and walking to school versus taking the bus or car transportation. A local farmer, another kind of initiative for us is being able to buy fresh produce and send that home weekly with our kids and our families. After school fitness programs, obviously, we do a lot of that anyways, but just more incorporated into our after school program. And then, of course, specialized programs. One of the ones that we pride ourselves on are our inclusive programs. We partner with a couple different organizations for that. We have specific autism programming that we do already. Once a month, we have several events that we're doing and just trying to increase that again as a family unit. So that was a lot. So I'll pause for questions.
I really appreciate the data because it's really important, right? To say that this is what you proposed, this is what you gathered, this is what you served, and then what you learned from that. Because that's really the important part as well, is not just gathering the data, but also analyzing it. To say that, we thought this was a great idea, it is, but we need to tweak it a bit to maybe make it more impactful. And I think that when we look at the rubric, right, that's what we're looking at, is how to make the most impact for the most people across the county in ways that are healthy in a bunch of different various categories.
Right.
So thank you for providing that in a way that's easily readable, that is really well written, right, and really does meet the things that we proposed in the rubric. So I thank you for bringing it back to us.
Yes, thank you. I appreciate that. Yeah, the blood pressure one was for us.
But I like
Tough one. Yeah.
how you brought up there were people that came back to you guys and like bought into the programs, but there are people that initiated conversation with their own primary care. And
Yeah.
being where I'm located, I saw a lot of patients who got contact from what was going on at the Portage Y and then came back and said, "We saw this over there. I should probably be on top of this." So they may not have hit you in your numbers, but they do in mine. And so, the net casts wider than we can sometimes see by numbers. So just that introduction and for people to get thinking and then discussing it with their physicians. I saw that personally in my own practice with this program. Yeah. And I know that that this nutrition and involving the kids has been something that's been really dear to your heart when we first started talking to you. So I think it's really exciting that we hit the seniors and we hit the kids all at the same time with this program, because those, I think, are our biggest need. And to do it in a fun environment. This is probably a place where these kids go to have fun and to let loose, enjoy themselves. And then if we could sneak in some, good information in there too, I think is the best of both worlds.
And I kind of like the idea of anything family oriented.
Yeah.
I feel like you're getting everybody involved.
Yes.
Because really, that's kind of the goal for our, as the health department, is to be reaching everybody and kind of making things more fun and interactive. So I think that's a great idea. Just in general.
This is a one-time grant, or because I was going to ask, what are our metrics as far as being able to deem it successful, and if it's a one-time grant, But I guess if it's a one-time grant, then you'd maybe give us a report at the end.
I think the same issue we hit our year from the previous grant, and hopefully we're here again
next year
and get to hear these updates and hear from people in the community.
Perfect.
I agree. The only thing that I always get a little nervous about is anything that's going towards a salary, because
we may lose.
We might not have funding for it next year. So I always reiterate that, if there's any way you guys can find funding for some of these positions,
so
would be beneficial.
It's really interesting because we're definitely in the people business, right? Like, you have to have a person to administer everything here. But I think for me, one of the really kind of amazing things that I've seen happening over the past 7 years that I've been at the Y is the insurance companies are starting to take more notice. And so, like the diabetes prevention program, for instance, there are some Ys right now that are able to bill Medicare for this. So it's huge. Like, it's not, nobody really thinks of a YMCA billing insurance. But it's coming. So as we continue to do these programs and we start to be able to collect this data and show that there is success, the insurance companies are noticing. So I anticipate that even by next year, I'm going to say, I don't need funding for these things because insurance is finally getting it. That is so important to do the prevention piece. Then they don't have the exceptional costs once somebody is diagnosed.
But for now, though, do you have a contingency or ability to pay those salaries? I mean, are these existing folks who are going to take this on in addition, or are these new standalone?
Yes. They're not new hires. Yeah. Yeah. So,
because if you hire a new person under grant funding, there is with that.
Yes.
Certainty.
It is. What we do is we take our people who are already doing some pieces of this, and then we just enhance it. And we go out of our building instead of just offering the program to people who walk in the door.
Salaries for program administration and facilitation, that $20,000 would be spread across.
Yes, it's not just one person. Yeah. Mm-hmm.
And then same thing that I asked the previous Y, make sure that there's room for the Porter County Department of Health and the Find Help advertisement along with you guys as well.
Yeah, absolutely. We have every flyer that we've done this year, the health department was recognized on that. On the magazine that went out, the health department was recognized on that. We even did a calendar this year that went out to all of our donors and businesses, which actually they have over there, and the health department's on that.
And these are on our Find Help website.
I don't, Carrie,
Like, yeah, I don't know. As far as they click their page for Find Help.
okay,
Oh yeah, we need to add that.
perfect. Yeah.
I know this is a tall ask actually of both YMCA's, but it'd be wonderful if you guys actually had the Find Help button on your websites. That would be very nice. Not even the Porter County Health Department, but just the Find Help button.
The Find
Yeah, that's not a me, but I can make my marketing person do that for sure.
Thank you. So at this time, I will propose a motion for us to take up a vote for the HFI funding renewal proposal and expansion to the Portage YMCA.
Second.
Thank you.
Dr. Watson,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Rosanna.
Yes.
Thank you.
Thank you, guys.
Keep up the good work.
Thank
All right. In old business, we have to discuss the Strength and Stillness program. How are you? How are you?
All right. So, I presented last month. This month, I have Samantha Aguilar here.
Okay.
She has done a lot. She's very well known, one in the community, but we've also used her to do yoga with law enforcement in our crisis intervention team training that happened last year. So, I was hoping first I could just run through the changes that we've made
Yes.
to our proposal. And then I actually, since our last meeting, it seems like yoga for first responders and the reentry and recovery community just keeps coming across my desk. So I actually found a few really cool studies to share as well. So first, our big update, one of the questions that was asked last meeting was if we could expand it and make sure that we were able to fill the classes. So what the sheriff's office has, they were more than on board with it, is to open it to first responders in general throughout Porter County. So police, fire, EMS, coroner's office, any first responder agency will be invited to attend. And then for those at Recovery Connection, that's geared towards the reentry and recovery communities that we're going to promote among our various community partners like Hilltop, the Community Resource Network, things like that. So we'll get a wide reach. The capacity is still 20 at Recovery Connection and 30 at the sheriff's office. But the ability to advertise it so widely, I think, is going to make it, one, it's already accessible, but two, it's going to make just a lot more people able to come. The other big adjustment we had, so last month, I know we already talked about the KPI being weight loss, and we had already included that in there. But since that meeting, I did a little bit more research, and we found, actually, I referred to the Connecticut State Police Department's yoga, how they mandate it for their officers. I mentioned that last meeting, and I went back and I pulled their presentation, which I hope was sent to you guys, maybe. Okay, good. So one of the things that stood out to me about that, statistically, they reported as they started implementing this with their department, it was 20% improvement in injury mitigation, use of force reduction, anxiety reduction, flexibility, and breath control. So, and I also included, I'm not sure if this was shared out with you, but I have a study showing that it actually prevents PTSD among first responders as well, the ability to practice yoga. So those were additions, in addition to the weight loss KPI that we mentioned last month. We also, the schedule remained the same. I know it was asked last meeting whether we would consider doing 6 months to see how it goes, and we're absolutely open to that. We broke down, so originally for Samantha's classes that she does for other agencies, that was the rate that we included in the last proposal. She came down significantly to make this more affordable. So you have the updated numbers and what it would be for 6 months or for a year. So we would be more than comfortable saying that, we would run this for 6 months, see what our numbers are looking like. And then if we wanted to do a year, we're happy to come back. But we cut the cost down significantly. And I also, in terms of sustainability, I know I mentioned So since the last meeting, we got contracted with one more MCE, so we have one more to go, and then we're finally at the end of the Medicaid tunnel. So that hopefully, in terms of the reentry and recovery side, will be a sustainability option. But I also spoke with the MAC, which is our law enforcement training center, about potentially after seeing how this goes, which I really feel that it will go well. But at the end, we the MAC they said you'd be more than welcome to facilitate this there, and they have other funding avenues as well, so that could be a sustainability option too. So then that gives us sustainability both from the law enforcement side as well as the reentry and recovery. And then I know it was also asked. This was actually sent to me. So I was in Wisconsin a few weeks ago for a first responder peer support wellness conference, and I accidentally ended up in a yoga for first responder session. And so the instructor of that actually sent me the data this morning. So you did not get to see this yet, but one of the things that stood out to me in the last meeting, I know I was asked to kind of gauge interest, and truthfully, with the first responders, it's extremely difficult because when you say yoga, a lot of times it's like, why would I do that? And the data that this instructor sent to me, she specializes in yoga for police. And the data that she pulled, it was with the U.S. Marshals, and she has it blocked out so that when they first asked the officers, how many of you would participate in yoga, 50% of them said yes, 50% said absolutely not, and then they did the courses with her, and then like 95% of them said, yeah, I would totally do yoga. So all that to say, I think once it starts happening and it's happening consistently, we're going to get a lot more buy-in. And because Samantha's the expert in yoga, I don't know if anybody has logistical questions about what it's like, but she and I talked a lot about how her style really incorporates the meditation component, so it is accessible to everybody. Like I said, I've fallen asleep in at least 4 of her classes, so it is very, one, helps with weight loss and physical fitness and all that, but 2, also absolutely calms the body and the brain and helps in all these different ways. So
Yeah.
What did I miss, or what questions?
Well, I would love to hear from you, like in terms of the service you provide, because I can say, speaking for myself, I know nothing about yoga.
Yeah.
I do have, I know a lot of people who participate in yoga, and I mean, in terms of helping with mental health, blood pressure control,
Yeah.
chronic pain. There's a lot of avenues where yoga I've seen be beneficial, but I'd love to hear it from your vantage point as an instructor.
Yeah, so I've been teaching yoga for about 8 years. It started off with more like physical fitness, and then as I began teaching, I was seeing how slowing it down and adding a little bit more breath work and adding a little bit more like gentleness to it was actually making it more accessible for people, and we were getting better results. So I primarily work with an older age group, I would say, and over the last like 8 years I've seen people go from kind of like waddling in, not really being able to walk, to being able to walk, which then now they're able to do a lot more physical activity, and they're able to have like a better genuine appreciation for life. So on top of that, I've also worked with like the CIT training, and then I've also done the reentry and the recovery population for quite a while now. And so to get into like the like yoga world for a minute, so like yoga is like an 8-limb path, and there's multiple things on that path. So one of them is asana, which is the movement, but the other parts are breath work, meditation, concentration, turning inward. So these are all different aspects that I feel like don't really get talked about a lot in the fitness world of yoga, but there are those benefits that people end up getting from taking it that they don't really realize is going to happen, which is what happened with me. I went to yoga just trying to be fit, and then next thing you know, I have like better like impulse control. I'm able to enjoy things a little bit better. I'm able to slow down, even though we both talk very fast. So these were all other benefits that I found. And so that's why I've started creating classes that are accessible to all fitness levels, accessible to all ages. Sam's been in class where I've taught the same class to people on the ground, seated, and in a chair. So I have a pretty good depth of working with different bodies in all the same class, so nobody feels like they're not able to participate or they feel awkward participating. So we've dealt with that before too, and going into also a little bit more of that is also
So we do like a lot of diaphragmatic breathing, which is stimulating to the parasympathetic nervous system. And so if we're working with obesity, we also want to make sure that we're working with cortisol, our stress hormone. And so that's kind of like that piece. I feel like that gets left out a lot with like fitness and obesity. Like it's more than just physical movement. Like I love to talk about nutrition because that's important. But then also we need to understand that we're whole beings. So how are we working in the body with those stress hormones? And we can't really hit that with just physical activity. That's where we need to bring in our element of, okay, what are some ways to stimulate that? Okay, so there's certain poses that stimulate our vagus nerve and our parasympathetic, and then there's also certain breathing techniques that we can do so that people are then able to bring down that cortisol and then effectively like adjunct their physical fitness or their nutrition programs that they're doing.
Very good.
Yeah.
Very good.
I could go on for hours, but are there any other
I-
specific questions?
This is what we were interested to hear.
Awesome.
Yeah, because I think, if you hit on the aspect of, a lot of what you were saying, this fight or flight,
Mm-hmm.
right, that becomes chronic,
Yes.
leads to chronic hormonal dysregulation, and then a lot of chronic, emotional dysregulation, behavioral dysregulation. I think if you sort of use it from that perspective too, not just, sort of the stereotypical, oh, I'm going to be a pretzel,
Yeah,
that
right.
what we think about yoga.
Yeah.
But if you are expanding it, because when we look at the rubric, and we're thinking about the capability of applying this to a wider audience, that's really part of the first responder struggle as well, is dealing with the emotional regulation, the emotional dysregulation that coming upon a scene can happen, that reliving a traumatic experience can happen, right? And so I think we also sort of expand that to say, how is this also efficacious in their lives beyond just weight loss? I mean, those are important,
Yeah.
Things, but I think what I had read from especially the things that Sam sent, in the research articles for minimizing the possible development of PTSD and those kinds of things, that goes a long way too, to expand a person's ability to continue in this, in maybe their police, abilities that maybe would help expand it as well. So I'm hoping that we can also bring that to bear in this, help them understand that it really covers their whole well-being, because I think, as a health department, we're really trying to expand mental health as physical health. So I appreciate you adding those things to that presentation.
No problem. Yeah. The first responders are a big cornerstone in our community. So making sure that they have like those programs that also help them, like not just physically, but also mentally is really important.
We agree. And I appreciate, responding to our feedback, including a wider range of people that can have this available to them, because that is one of the things that we struggle with this funding. We want to try to reach as many people as we can. And so I appreciate that you looked into those avenues and have incorporated them. I appreciate you cutting down the budget. I mean, this is all what we're all dealing with, and we don't even fully know what our budget will be. So I appreciate that. I very much notice that and appreciate that.
Excellent presentation.
Yeah.
As far as getting this out to both the first responders as well as the recovery community, I don't see anything budgeted here for that. Do you guys have an idea of how you're going to get that out?
Yeah, it shouldn't incur additional costs. So we actually this morning, for example, I sent out an email to all of the police agencies, and it won't be difficult to incorporate the other first responder agencies too. That was specific to our crisis intervention team training, but we have those emails going to the law enforcement agencies all the time. And then we also have our wellness meetings through the MAC as well as at the sheriff's office. So that will be no issue. And then for the print materials, Recovery Connection is fully on board with promoting it there among the hundreds of people that come in for meetings there. And then the CRN meeting, Community Resource Network, that I host at the Sheriff's Office, Demetrius does our newsletter actually for that. So it's free to put it in there. We have like 200 or so agencies that are on that mailing list. So it won't cost extra, but it won't be hard to get it out.
Thank you.
Yeah.
And when did you propose this would begin?
Both locations are ready to go. can barely remember what year we're in. I mean,
All right.
I mean, here, here
Crazy.
Well, I think we had talked about like May, June was something that we were both available whenever a start date was.
Well, we're going to launch this program by our health fair, so I think that would be a good time for us to have that available with our launch.
Mhm.
Too.
yeah, if we had a month or two to advertise, and
Yeah.
then I'd say I think June is
Mhm.
ideal.
Yeah.
Anything else?
So at this time, I'd like to put the proposal for us to vote for HFI funding proposal for Strength and Stillness program.
Do we need to distinguish between the 1 year and the 6-month proposal?
I don't think so because
I don't think.
the new proposal I think
Yeah.
specifies that they sent.
But are we voting for the 1 year or the 6 months?
Oh, for the 6 month.
We're voting for the
Yeah, because I think your proposal now is for the 6 month, correct?
And then
If-
reevaluate
6
your
months, we're fine. We are fine. Either.
reevaluate
Yeah.
where it's at.
I
Absolutely.
think for 6 months, but
Yeah.
I wanted to make sure because the proposal has both in it.
Yes.
I'm sorry, could I recommend that maybe we go through the end of the year just because of our.
Yeah.
End of
Yeah,
the
yeah.
perfect.
That's fine.
Yeah.
That's fine. Yeah.
So we don't have the full number then for that. Is it okay if we continue to vote pending that final number?
Yeah.
I think so.
As long as the fraction makes sense.
Okay. You're okay with that?
Mhm.
Okay. So motion for the Strength and Stillness program.
Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osan,
No. April Fools. Yes.
Like,
He's a hard sell. Hard sell.
I can't help it.
You're the first.
really?
I got a dirty look from I win tonight.
Thank
Right.
Thank you.
I hope he's in better position
Wow.
than he is a comic.
Yes.
Oh,
All right.
thank you.
Thank you. Thank you all for your
You actually got me even worse than my wife with that
No.
there. I mean, good luck. You got that down, Dave.
All right. Report of our board attorney. Okay, you have a lot of things underlined
Well,
and circled.
yes, I'm prepared here. There will be a quiz at the end.
Oh no.
But seriously, it is April Fool.
It?
And he took my line away
Oh, Steve.
It's also
By the dirty look.
it's also the first day of the last month of the General Assembly.
Oh.
Now I'm sure there's no correlation whatsoever. But what's important, well, all of it's important. But what really starts focusing our time and our energy of reviewing is once we cross the halfway point in the legislative lawmaking process, then bills have to be out of their respective houses before that if there's any possibility that they're going to become law. And if Carrie and I are the ones who do the watching of these laws, we'd be running around chasing our tail if we tried to follow all the laws that got submitted. I mean, there's about 1,400 in the House and about 900 in the Senate, and so we kind of just glance through them until we get to this point where it starts becoming important that we know what's going on in Indianapolis. And just some of the highlights that I'm going to talk about, and then I'm going to ask Carrie, because she has contacts as well through the state, to kind of fill us in and make sure we all understand where we are. As has already been alluded to by a couple of you up here, we are in the biennial budget making process, and we simply at this point don't know what's going to come out of the legislature by way of the new budget. We've heard some things that are a little troubling in terms of what may be on the minds of some of the legislatures. Carrie and I are both convinced that our local legislators are supportive of what we're doing and would like to keep it around. But I'm going to defer to Carrie to give us a minute or two discussion of what her sources are telling her through the state Department of Health as to what we may be facing and what may come out of the budget process.
Yeah, and I don't want to speak too soon for Dr. Boxer because we've talked about this a little bit. We have meetings every other Tuesday. We have a local health department updates meeting, and then on the other Tuesdays we have grants meetings. So we have things to report out of both meetings this month. On our local health department updates last Tuesday, so a week ago today, Dr. Weaver was actually on to talk with all of us. So the Health First Indiana is in the biennium state budget. So that's House Bill 1001 each session. It's a budget session. In this session, as you know, we've talked about this, Governor Braun did put the initiative in at $100 million each year. So last year it was 75. This year it's funded at 150. So he had put it in there. He does believe in it. It's part of his plan for Indiana chronic disease prevention, and so he put it in at 100 million each. It went out of the House and into the Senate at the halfway point, and the Senate has referred it to the Appropriations Committee, which is where it sits right now. So when it was in appropriations discussion, there are legislators that would like to see it completely removed from the budget, and others that would like to see it phased from 100 to 50 and then disappear in the next biennium. And so it has to do with other budgeting things that are going on in the state. And so she was making us aware of that. And then on Wednesday of last week, Tuesday, and then on Wednesday, we received a call from a reporter who wanted to speak with us because she's been assigned to follow appropriations, and so she had heard that same conversation. So I don't know if you guys saw it, but it came out in the post. Yeah.
Good. Yeah.
They interviewed Lake County and us as well about what we've been able to do over the last 2 years, what our plans are going forward, and what it would mean to lose the funding or for it to be drastically cut. So one of the things Dr. Weaver did ask for is that we reach out to our partners, which we did. Every partner you see sitting here has contacted every single legislator that we have that represents our county and the surrounding counties and received responses back that they've also shared with us. We have heard a lot of support from our local legislators, but they also asked that we would reach out to our boards of health. And so after the meeting, if it's okay, we'll send you guys an email. And of course, you can write whatever you feel inclined, but I did kind of provide like
a skeleton email.
As well. And so I think some of the biggest things that each of our partners represent put in their own personal experiences and stories. So any of those things that you want to share, of course, that's especially impactful. And as Dave mentioned, I think we would hear too is that our legislators have expressed that they are very supportive, and so hopefully that will continue forward. So that's where we are at with that budget bill, and we will know by the end of April.
I was going to say, so where is that bill at the moment?
Appropriations. Senate.
Okay, so it's in the Senate currently.
It's at the Senate.
Okay.
Yeah.
So the state does not know what's going to happen in the federally. And so I don't know how this usually works, because if you look at the other bills, and I even looked a lot at the budget bill previous to this, they all get lined and commented and all this stuff. Nothing has happened because I just don't think that they know exactly what they're getting from the federal government, where they sit in that area either. It has not been marked up at all, and I don't know what that means for the budget bill. I don't know if you.
Well, in fairness to them, they're looking at a gigantic problem with Medicare.
Medicaid.
Medicaid.
Yeah.
I'm sorry.
Yeah.
In terms of funding, and that just permeates all the discussions about the budget. So, but we're watching it, and we'll keep you knowledgeable of movement in that regard, and hopefully we will succeed in securing the continuation of the funding. Some other ones, and this is one that's near and dear to my heart. Right now, under Indiana law, your birth certificate is a confidential record for 75 years, at which point it's a public record. There's a legislature who thinks that we should increase that to 99 years. And considering the fact that I'm 77, that would mean mine would be confidential again. Right now, anybody could walk in here, ask for Dave Hollenbeck's birth certificate, and might disclose some things that I'm not interested in disclosing. But anyway, that's something that seems to have some support in the legislature. Another bill that is still alive involves the creation of a statewide regulatory scheme for what? Food trucks. And maybe, Susan, we have some concerns just because we don't know how that will play out, but
it looks like if you wanted a statewide permit, you pay $450. 200 would stay here. 250 would get shifted to the state. That was the latest and greatest. But still, I don't know how it would work with food trucks who have been permitted in other counties coming here.
So that complicates your life.
It really
And what do we normally get paid for all of this work?
So they capped us at 200 last year, so that's in line with that. So hopefully that means the state people who normally permit, but what it does take away is anybody who didn't kind of permit, then we would charge a single day permit fee. Now, what we can do is charge an inspection fee, which in the past we have not had in our fee schedule, which we will implement. But then that means that we'll have to get away from them to take money from the field, because obviously we do not want to take cash or check.
Yeah.
For obvious purposes, for their protection and ours and everybody's. And so I would suspect that because it does, though this is going to pass, and then there are parts of it that take effect, in July. And parts of it don't.
This year.
Until 2027.
Okay.
So we will have some, but we will probably be coming before you requesting them to add an inspection fee.
Because this affects our sustainability, right? This affects our bottom line. This is somewhat how we remain independent with these things that we charge and pay for. And so this is cutting into that, right?
Because it's supposed to work that any fee we set, they charge if it costs to do it. But then never fails, especially on the foods and environmental side. It's hopeful it's not, and then they cap with charge.
That's the thing that's most shocking to me. That we constantly get told home rule. Each county develops what they want for themselves, but this is just both with the environmental and how foods coming. The state says so. So the home rule kind of goes under the table now. I appreciate you being proactive. I know you reached out to legislators and different people to ask for them to reconsider some of these choices. And it bothers me to make such a bigger struggle for each local department. But it is what it is, I suppose.
we continue to monitor that, and we'll keep each of you involved. We're also monitoring House Bill 1562 that has made it out of the House into the Senate. And this is the cook in your backyard, we call it, okay? This bill opens up the ability to cook food at home for sale. And then in a strange modification of that, says that you can do that as long as you don't make more than $1,500,000 a year doing
No sweat there.
What?
I know I'm laughing because I'd be crying while I'm laughing. I know our staff has some real concern.
Can you share with us what this means?
Yeah, maybe go into detail.
Yeah, I want a detail.
Yeah.
This sounds worrisome.
Well, and also, anything but, so that's what, but that's. Or THC.
Oh, well, okay. Thank God. Yeah.
Swedish meatballs.
No.
But, our vendors are very
required to be refrigerated for food safety. You know, related stuff now in school, and we are very limited in what we could do. It seems like a lot of that, like there's foodborne infections related to a home-based vendor afterwards when you come in and tell us. It's also a little bit up in the air, so it is very concerning. Also, I feel like a lot of people would be like, ah, I don't need a permit anymore. Which is what I want to do. They can fill it anywhere. Sell it out of the trunk. Sell cheese tamales.
So they don't need a permit at all for any of it.
We're not allowed to regulate them
For people making products from their home,
from their home.
as long as it's not meat. Or
alcohol. Or alcohol.
Oh, or
And we'll also have to ask for their federal income tax return as well.
oh, for people.
Are you think of that? $1,500,000 a year, mom and pop cooking corn in the backyard.
We have restaurants that are going home. Like,
Wow.
But anyway, that's one that raises to another level of concern. Watching. Carrie, are there others you'd like to bring up?
I don't think so. Yeah.
Okay.
Okay, well, that's what we face, and we'll continue to fight for the good cause, and we will keep you informed.
So this one in particular has made it through.
Yes. So
Yeah.
from the House to the Senate, and it's been referred to the committee of action.
So they have all pushed. They've been okay with this. This has gone through.
Yes.
Okay, good to know.
Everyone we talked about is at that stage. I mean, it's
Yeah.
already left.
Okay.
I guess in closing, I'd simply say that you can't sleep until the legislature's gone home, because what happens is these things that maybe never got out of committee at 11:58 on the last night of the legislative session, when half of them have gone home already, somebody puts one of these in that didn't get out of committee. I don't know if you are aware of this, but it could be a good thing and a bad thing. We have a national park in Porter County because what our congressman did at the 11th hour in a bill. One sentence. And we have one of 62 or 63 national parks. So it isn't always bad, but it usually is. So we need to watch those, and we will continue to watch them, and we'll keep you advised. And any way you can be proactive, especially on the budget bill, would be incredibly important as we fight the good fight. The report, Madam Chair.
Oh, sorry. Are we recommending any of our counselors, the county council, or anyone reaching out to the legislative about this health department?
I can't put myself in a position where I'm discouraging anyone.
Yes, yeah.
I mean, I didn't know if we've reached out to them as well.
Thank you for bringing that up, because that was actually one of the questions that I was going to ask you, as I certainly was going to send that same email.
I think it can go out to all of us. Yeah, the board, the county council, the commission. I think our community partners, just like when we started this process in the first place, all the people that we begged to go to the legislature and approve this funding, and now for us to share the impact that this funding has had. In reading things that Senator Charbonneau has said or speaking to him, some of the feedback is, they haven't seen the return of investment yet, but as we know, working in public health, we're not changing obesity numbers in 2 years. We're not, these things in terms of, trauma and injury prevention, chronic health and illness, these are things that we know that are going to be generational in terms of finding those types of rewards. So it's kind of an unfair burden that, we've kind of been given in terms of response to this funding. So I think the more our legislators, I know our local people are in support of it, but more, the more we can get this out, and they can take our letters and give it to others too, of the impact that we've seen and that we've shared and that we've worked together, and why this is important to continue. Because the concept of it not existing at all is just
No, I mean,
terrifying.
yeah, and it's really puts a burden on the counties throughout the state.
Well, and I think, that's the big take home message for all of this stuff. When we hear federal cuts, then it comes to the state. And if the state cuts, then it comes to us. I mean, these things need to be taken care of. We can't pretend like these things don't. And so the more we all work together, the more smooth this process goes.
In the email is that you guys have the annual report in front of you tonight, but also I attached that spreadsheet that had all of our provided in 2024 to help if you wanted to review that, and the link to our website where our success stories are on there for our partners as well. So just kind of some information to reference. Thank you.
Thank you. Thank you. Thank you. Well, we'll all be paying attention, I suppose. So next up, we all should have had a chance to sign our claims and receipts. If I can have a motion to approve the claims and receipts.
Motion to approve.
Second.
Thank you.
Dr. Watson,
Yes.
Dr. Brunt,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osan,
Yes.
thank you.
You. So moving on to reports of committee staff and health officer, I have a matter. I was contacted by Sue Neff, who is our county appointee to the Shared Ethics Advisory Commission. She reached out to me as a member of the Board of Health to discuss this ethics training seminar that gets held in Maryville once a year. Traditionally, all of the county entities have been invited. It's a dinner, a symposium, a speaker, I believe at the Avalon. And so she's a new appointee to this commission, so she wanted to expand upon Porter County's involvement and attendance to this. So she sent the invite out to us, which we will share with all of you if you're interested in attending this this dinner. It's at the last Thursday in May, I believe, at the Avalon in Maryville. And with this, we'll have the link that you can register to go if you choose to attend. I'm planning to attend to represent us if anyone. I know sometimes people from the health department go every year. So if there's anyone that joins me, send me a message if you're available to go. So look out for that email that Carrie will disseminate out that came from Sunef. Then moving on will be Sam and Megan Judy to report on Community Change Center. This is cool stuff.
Everybody will be real tired of me by the end of the
No, you're awesome. We appreciate it. Yeah, okay, here we go.
Dimitri's got our slides. All right, so actually, I put this brief presentation together for a really exciting spotlight presentation I got to do with IDOH. So if you can go to the next slide, Demetrius, for me. I think that you all already have a general background of the organization from when this initially pushed through, but I wanted to introduce Megan Judy to everyone. She is our new reentry program coordinator that you all generously funded for year one. But just in case anybody wasn't here when all of this,
we do have new members.
Okay, perfect. So to give a quick background of the organization, the Community Change Center is a nonprofit that I started back in 2019. At that time, I was running reentry programming in Porter County Juvenile Detention and Westville Correctional Facility, and I was really seeing a need for comprehensive reentry services that starts when people are incarcerated and then helps them transition back out in the community and provides wraparound services to reduce the likelihood that they recidivate. So at this point, when the organization began, I bought a Nonprofits for Dummies book on eBay and somehow filed everything correctly, and we had no money and resources and very little support. But this is what we have at this point in time. So we still run our pre-release program in Westville. We're in there every Thursday doing life skills and building a community with the guys. So then when they come back, some of them to Porter County, then we continue working with them. We have 2 transitional living homes in Gary. One has been open for about 2 years. And actually, my favorite thing of the org is that we operate so full circle. So the live-in house manager in that home actually was in our original group in Westville Prison like 7 years ago. So we're opening the second reentry home here in the next month or 2. We run a Unity Cafe at a Living Hope Church in Valpo, so we do a weekly Recovery Connection sends us a recovery coach. They run a support group, and then we do free community dinner at the church every Friday. We serve approximately 80 people every week. Many are struggling with substance use or mental health, homelessness, usually all of the issues. But we also get a lot of people that have no idea what issues are in the community that come. And so then it's really been an eye opener and kind of a relationship builder for people that typically wouldn't engage with each other. We also, the adult education program, we just assist with facilitating. That one is in Gary in partnership with NEO and Portage. We do Second Chance Saturdays. That's our annual expungement fair. So a lot of people actually qualify for an automatic expungement after a certain amount of time since their offense, but they cost usually thousands of dollars. So there's a lot of people that miss out on job opportunities because they can't afford an expungement. So we partner with attorneys who do that pro bono for 20 to 30 people bouncing between Lake and Porter counties each year. We also have a Voices of Reentry podcast. So as we have people that are released from incarceration back in the community, once they're stable and doing well, we give them a chance to have a platform to share their voice and their experience. One, to kind of reduce stigma in the community, and two, to show other people that are returning post-incarceration, hey, there is hope for me. We're also working on building this statewide support network. So the only organization in Indiana that is similar to ours, and they've been around for a few decades. So their PACE is operating on a larger scale, but they're the only one. So if you're not returning to Marion County after incarceration, then for most people, they're just out of luck. So I think I might have mentioned whenever I talked about the food truck last time, we're striving to create the Homeboy Industries of Northwest Indiana. So Homeboy is based in LA. They're the largest gang rehab reentry program in the world. And so after Megan speaks, then I'll kind of share the large scale vision of all this. And then lastly, with the support network though, we are at this point, because there's such a limited amount of reentry programs that exist in our state, we're finding that people from all over the state reach out to us and say, hey, what's available in my area? So we're really trying to have resources available no matter where somebody's returning to post-incarceration, which we actually encounter a lot in our Porter County Jail as well. And then lastly, we have our Breaking the Cycle merchandise line. We got a small grant through Eli Lilly that allowed us to start pushing out. It's actually happening in my basement right now. But we're creating apparel that eventually will turn into a job for our clients to create it. So we sell that, and they all say Breaking the Cycle. So it's a stigma, for stigma reduction, but also to generate employment. So that is what we had going on. And then through HFI funds, we were able to hire Megan. In the first 2 months that we've had her, she's done what I've been trying to do for like 3.5 years. So if we can go to the next slide, Demetrius, and then Megan will kind of share what she's been working on, and then I'll tie it into our long-term vision here.
Yeah, so I just want to say, first of all, thank you, because I wouldn't be here without you guys. So I appreciate it very much. In the first 2 months of my employment with Sam, I have hit the ground running. So first of all, in February, we opened our reentry support office hours. So Sam had this lovely idea of having walk-in availability. So not having to make an appointment, we were just available. So we started out with 3 days a week. That is still currently, we're still currently doing that as we're trying to build our clientele. So we operate 3 days a week, Monday, Tuesday, and Thursdays from 10 to 2. And just as a result of that, we have 7 ongoing clients and up to 40 contacts in the past month. So we are taking care of our clients. We're also working through community partnerships to make sure that we can service them the best. So we're working with programs such as like Gabriel's Horn and Salvation Army, and they are great referral sources. So anytime they can't figure something out, they contact me and we work together to figure it out. So I think really the case management piece, reentry support, has been really great for the community because we are all working together. As a part of these reentry support services, we are really starting to look at employment. So we obviously have Fresh Starts, which is our second chance employment, but we really wanted an in-house education piece to kind of further along some of the clients that we're working with. So we came up with Set for Success, which is a workforce readiness development program that we are currently working on the curriculum and getting ready to roll that out in the next couple months. So it'll be a 2-week-long, 6-day program, very much dedicated to anything and everything that a person could need, skill level, soft skill level wise, for going back out into the workforce. At the end, they'll get a certificate that says that they work through all of this, and then we'll connect them with our Second Chance Employment Network, which we are currently cultivating. We've been reaching out to employers in the area, local employment opportunities, kind of getting them to talk about, second chance employment and what that looks like for them. And then also, presenting them with the research that, sometimes people with justice involved backgrounds make the best employees, the most loyal employees. So we're starting to have those conversations. Now, granted, this has only been 2 months in, so we're still working on it. And then the other thing that we are really working hard on is getting together life skills workshops. So we are setting up, we're looking toward June starting these where we are offering them to our clientele, and also the clientele of Recovery Connection and the community, opening them up to having workshop leaders come in and teach them skills that are beneficial to just learning how to do everyday things. So financial literacy, creative coping, mental health crisis services, things like that, which we'll be doing once monthly at the start, hopefully twice a month if we're lucky. So we'll bring, pillars of our community in to have them teach these 1 to 2 hour workshops every month. The other thing that I am super proud of is the neighborhood mentorship program. That is probably one of the biggest programs that we're working on right now. We are taking justice involved individuals, so someone who has had any type of justice involvement, whether that be from a career basis, so previous law enforcement officers, or people who have experienced jail or prison time. So we're bringing them in to be mentors to young adult populations who are kind of headed toward that type of life. So we're doing it very uniquely. We're creating organic relationships between those individuals. So we're not using the terms mentor, mentee, we're just using the neighborhood. So we're creating those very organic kind of, upstream preventative measures to these young adults. So I'm very excited about that. That's my baby. I will be very honest about that. We're looking to do the mentor orientation this month. Actually, it's April. At the end of this month, and rolling out the kickoff of our program in May.
And I just wanted to say too, as we rolled out that program, the neighborhood specifically, we were really trying to focus on the young adults that are often falling through the cracks because you can't say to them, if they just got out of JDC, you can't say, I'm going to pair you with a mentor. They're really going to help you. They don't want a mentor. They don't think they need a mentor in most cases. So I was focusing on the benefit that it would have to the young people who are the mentees. And what I really didn't fully anticipate was the impact that it would have on the mentors in the program. So one of them did an interview with Megan, and like 20 minutes later messaged me on Facebook, and all he said was, thank you so much, I really needed that. So the ability for them to give back and help the next person has proven really impactful as well. And as far as the second chance employment goes, like I said, we have that apparel line that will be a ways off before it generates enough funding to keep hiring people. But the food truck, if you drive by Living Hope on Calumet, where we do the Unity Cafe, we partnered with them, and so it's housed there. So if you wanted to go see it, that is the actual picture Semco wrapped it for us a couple weeks ago. So we're doing an unveiling, which will be on the last slide that I hope you can attend. We're doing that on April 26th, and then we'll roll out and start serving in May. So that's coming along really well. Our plan is to start out with a few employees, and then once we know exactly how much profit is bringing in, to be able to have a full-timer and a handful of part-timers on that truck. So we're very close to launching it. But without Megan, without the funding for Megan for this year, we absolutely could not be where we are. So thank you. And then if we can go, yes, thanks. So big picture here, we have all these moving components. Like I said, when I was up here a little bit ago, we have one more MCE to get in contact with. I know with all of the questions about Medicaid, our board has been a little bit nervous, but I think our saving grace is that we already work with Recovery Works. So Recovery Works through DMHA provides some funding for our reentry homes. And once we are a full Medicaid provider and in contract with all the entities, then Recovery Works, we're in the process of becoming a level 4 provider rather than a level 3. And so that opens a door of a ton of billing options that then allows the services Megan's providing to become billable and lets us be self-sufficient. And then we'll be generating the employment through the Second Chance Employment Program. And then really, I can't remember if I said it when I was here last time or not, but just in the several years that I've been doing this and working within law enforcement and also with the nonprofit sector, I've really seen this new recognition and partnership between the two, where law enforcement is starting to recognize we can and should provide all these services while people are on the inside, but then if we don't have all the services for when they come out, then it's, a lot of them are still going to keep going back. And so I've seen a huge shift in just the awareness and the support between local government and law enforcement for this type of work. And so I think that all three of these combined is going to be what allows us to actually create that homeboy of the region. And then on the last, oh, just kidding. So that's our contact info if anybody wants to learn more. On the next slide, this is our invite to the food truck. I included in the email, so hopefully you got the personalized version of that too. But I would love if you can make it. I want to make sure we have enough food, so if you RSVP, that would be great. But does anybody have a question?
What is the menu like?
Oh yeah, good question. Yeah, I forgot. So in our long-term vision, part of the Homeboy model in their employment is they have their Homegirl Cafe. So it's actually in their headquarters, and so that's what we're working towards is a full diner, so that we can employ larger numbers of people and we can be addressing the stigma by inviting people into this environment where they know they're being served by justice involved people, so they're able to put that human face to a population that can seem really scary. So because we're working on the diner and I had no idea what I was doing coming into it, we started with the small scale with the same menu that we would then expand to the diner. So we're doing diner style with Chicago hot dogs and cheesesteaks, and we have like 4 different types of burgers and loaded fries and all the stuff that probably isn't the right thing to be talking about here, but but it will be tasty. Then they'll do yoga after to help mitigate that. Anything else?
Comprehensive.
Yeah. Yeah.
So do you have data at all about recidivism rate and the way that this impacts that?
That's a great question. So IDOC puts it at about 30%. If you look at all the carceral facilities, and it's more like between 80 and 90%. So it's really the difficulty in that Community Change Center has in tracking our data is because recidivism can be measured different ways. A lot of agencies tend to measure it over a span of 3 years. So unfortunately, like once Megan has clients for a longer period of time, we can track recidivism among them. But I will say just in the men who are in our pre-release program, and then especially if they're returning to Lake or Porter County and they move into our homes, like phenomenal, because we're working so closely together that it's pretty rare that somebody we've worked with intensely returns, that they get rearrested. So it's working. It's just really hard to show it in numbers in terms, especially with her clientele right now. But eventually we will absolutely have that.
You have to start somewhere.
Yeah. Yes.
Yeah.
I was almost wondering do you guys keep track? I mean, I'm assuming you guys keep track of who's been incarcerated and then who has been repeatedly incarcerated after.
Yeah. Yes. And because we're dealing with, it's all the justice involved population, but it's different. It's significantly different if you look at the jail population versus the prison population. And because we work with both, it's even harder to track. I mean, usually if they've gone, what we see among our clients is that once they've served prison time and we have worked with them for longer, they're not going back nearly as frequently than the ones who are cycling in and out of the jail, which is really largely who Megan is here to work with to break that cycle, because we have never had anything if they're not on probation, and a probation officer can't even afford, have the time to deal with somebody in the capacity that Megan will. So that's what we have been missing, and what her position really is designed to address is largely those cycling in and out of jail. So we'll have numbers one of these days.
Because I just know, having been, several times in the reentry program in Westville, I've had lots of students over the years work there. I've been there many times, attended a lot of their classes. And so this is a very needed thing. And talking to a lot of the men that were there, because that wasn't only men. But, the recidivism rate was really high. And so if this can cut that down,
absolutely,
it'd be great.
Yeah, it's amazing really how many since Megan was hired, even the amount of federally funded large agencies that reach out to us and say, our clients cannot get hired anywhere, can you help us? And at this point, I mean, she's doing case management with them, but we know that we need the employment programming and to build out the employer network to be able to address it on a larger scale. So that's why she's so pivotal to the process.
Thank you guys for all your hard work. This is amazing.
Incredible.
Thank you for making it possible.
Yes. Well done. Well done. Thank you.
Hope to see you on the 26th.
I'm gonna have to.
Okay. Yeah. Yeah.
And then that way.
The rest of these you direct how they order.
Yeah.
Them to go. They're all yours.
I'm going to bring up my help. There was a request last presentation, there's a one-sheeter in front of you that Carrie passed out at the beginning.
So I was able to look at some of the analytics from 2024 and then compare them to where we are now. We've been doing a lot of work getting categories figured out, making sure things categories correct, identifying who's a network member as part of the community resource network, an affiliate who may not come to the meetings but we know is a good credible resource and are engaged with some of us that are members. And then most recently we identified a resource. So maybe they're not local to Porter County, but they're somebody that Sam refers to, I refer to a lot, but we want to make sure they're appearing closer to the top of the search. So that's where we came up with resource. Some of the categories will pull 90 different resources, but those include local, other counties, and then federal listings. So to make it easier to navigate, because when somebody's searching, they're not going to want to go through page and page and page. So we've been working to do that. In 2024, we had over 3,000 users of the website. And then in comparing the first 3 months of last year to this year, the number has almost doubled. So as we continue to spread the word, individuals start adding it to the website or signature and things like that, I think it'll grow. And then searches in Porter County, that has almost doubled as well compared to the first 3 months of last year when we had first started out to this year. And then on the back of that page, you can see some of the most commonly searched items, such as food pantries, emergency and temporary shelter, financial assistance, and things like that, which I know aligns with a lot of work I make and resources that I give to individuals. And so that's kind of the nutshell of everything for 2024 to current. And Sam has some good testimonies. I've worked with the Center Township trustee a lot to get it added to their signature, to get it added to their website, and then Sam gets a lot of feedback, and I'll let you talk about that. Sorry.
Yeah, no. So a lot of times this feels like running a marathon, and we want it to move way faster than it does. And so this was really awesome. About a month ago, I was given a presentation to Sunrise Kiwanis, and I didn't know a lot of the people in the room. And this, they at the beginning of their meetings, they do a little like a happy moment of the week. And she said her happy moment was knowing that St. Vincent de Paul can refer to this. She said how much easier it has made life for their volunteers when they know how and where to direct their people that are seeking services from them to resources, and they never had that before. So that was a good reminder and pickup for me that it is working in the community. And when we had our community resource network meeting last week, afterwards, Monica with Juvenile Services came up and said that a lot of the families that are not, the kid is not on probation, so they're not actually servicing the family. She said it's been hugely helpful for their officers to be able to point them to the Find Help site so that the family is given resources even if they're not being serviced through the agency. So that was uplifting as well. And then I know that just personally, myself and Ellen, the second police social worker at the sheriff's office, use this all the time. We used to sort through like a 180-page document and piecemeal that out for people. And so it's just been amazing to have one place to send everybody and know they're getting uniform, correct referrals.
Yeah, exciting. And I use it all the time too. And one of the things with the analytics, I'm in it multiple times a day. So it was nice to see that I'm not counted each time I'm in it throughout the day. I'm counted as one user. And yeah. You guys have any questions about any?
I would we consider like some sort of like social media like promotion that we could share? Like this is Find Help, this is what it entails, and like my office page could share that, or the Y could share that, something like that. I've not seen that exist. Does it exist, or was it a long time ago that I've seen?
We have cards where we can share what the website is or to claim your page. When I do Porter County Suicide Prevention Task Force pages, I'll often reference that as if you're looking for resources for mental health or anything else, you can go to the website. But I think definitely, since we have the website where we want it to be and have made a lot of progress with it, I think that would be our next step. Definitely.
Dimitri has made. It's been a while, but I know you made quite a few campaigns like that, especially when we were getting rolling.
In the beginning
Also, one
stages.
of our promotional videos.
Yeah, we should.
Feature Find Help also. But it has been a while since we put something on social media.
We've also had it on our agenda this spring to roll out a card claim campaign and really start publicizing it. We wanted to make sure it was in a good spot,
Right.
filtering correctly before we really pushed it out. But it's been over a year at this point. Like we talked with the libraries about putting on their computers and possibly the kiosks around town, putting it everywhere so that it's
Well, I think
accessible.
Dr. Oster or Robin, I don't remember which one of you brought up, like to have it in the ER, you know?
Yeah, I mean, honestly, one of the things I have some of the little magnets in my office that I put up on the doors. The problem is they're just so small. I used to be a pharmaceutical rep, so I'm pretty good at like putting things on people's doors and doctors' offices. One of the things that worked really well was the self-clingy,
Yeah.
like big posters. I think if you guys could do something like that, I'm sure there would be a lot of emergency rooms, doctors' offices.
Put it up
As long as
I
it
have
doesn't,
glass doors.
it's not permanent. Exactly,
Yeah.
glass doors.
Yeah.
The self-clingy with the URL or the QR code.
Or where people check in,
Right.
like that.
That would absolutely. I'm sure Powers Health would absolutely be okay with something like that because it's not advertising a commercial product, but
No.
it's something that would be helpful for patients.
Nice. I think our CRN members seem to, now that the website is like, especially with the favorites folders that are new, now that we're in a better spot with the site, then we've seen a lot of our CRN members say, hey, can Carrie help us like embedded in our email signature? So
Right.
I think you just helped Juvenile Services
I
do that today, right? So that's helping push it out there a lot.
And have the QR code?
Yes, we have several QR codes. So we have what's called ref tags. We're not IT people, so I'm not sure.
Yeah.
But
No.
it's basically the portercounty.findhelp.com, and then it references email signature. So we're able to see in our analytics how many people are getting to it from the email signature. And I didn't want to give you too much, so I can certainly.
What has been the most successful where people go to it from?
The email signature and probably our magnets.
Okay.
But we also created one for juvenile probation, so we can let them know, hey, how it's going, and then trustees. So the trustees has one specific, so that hopefully we can get that buy-in for them to add it to their page, so they can see it as making a difference.
Like I would envision like North Shore, HealthLink,
Right.
Those types of establishments. Yeah.
HealthLink comes all the time, and I think I don't know where their marketing team is at with that, but yeah, when we roll out the campaign.
I know her, so I can check with her. Yeah. I'll be honest, sometimes it gets challenging because the bigger the organization, the higher up it has to go.
I remember that with Porter when we were talking.
Yeah.
And
I forgot.
so,
Can't even put it on their website.
Yes, yeah.
and CoAction had a change, so I don't believe it got on their website either. So, but we certainly keep trying.
Yeah. All we can do.
And yeah, we're definitely. I like the window cling. I just created something for another group I'm part of, so we can definitely make something for that.
One more thing, I think part of the problem is that Find Help sounds wonderful, but I think people don't know what that means, right? So part of the video potentially, Demetrius, like having something like need this, find help, need this, find help. Having that video just to instruct people what it is right when they click on it so they can understand what it is, I think would be ideal too, because it's so broad that I don't think people realize that. Find help for what, right?
Right.
And do you have it at like Valpo University, Ivy Tech, like those places as well? Because I mean, I know a lot of college students are very reticent, but they'll come up to me after class and they'll be like, "Hey, Dr. B, could you tell me like how I can I, and like so like I know very often that there's a lot going on that we don't assume, in college students' lives and then their families' lives. So I don't know if we have the ability to push it out beyond just K through 12, but also in our college groups because there's a lot of insecurity, food insecurity, housing insecurity, transportation insecurity, especially.
Yeah.
And so one of the things that Valpo University wanted when they co-sponsored was a landing place for college students. And I believe you can see it on your computer screen where we have our shortcuts and we do have college students.
Okay.
And honestly, we need the community's help and your help with helping to promote it as well. But I definitely think there's room for more social media promotion and getting the magnets, creating some window clings, and then I can work with Demetrius to do another video just navigating some search. We have it in our initial video, but we can definitely expand on it, especially since we've added so much to it.
Excellent work.
Very good.
I have spent so much time on this.
Yes, I know.
Just
So-
amazing.
Labor of love.
Amazing.
We had a manager change, so in the middle, so we've gotten used to a new one. We have every other week meetings, and then Ellen, who also works with Sam at the sheriff's department, so we're meeting now every other week on the off weeks, just so we can get things going. They've added program management so that we as administrators can now go in and edit programs. I kind of think we're a pilot for that because we are so involved in our site and wanting to get it to where it's to be and easy to search.
Very good.
It has been cool too. It's good to see them asking for our feedback on the process. So I don't know if you sat in on one of them yet or not, but I got to do this Find Help Focus session back a few weeks ago, and they were asking, how is it going for your county? What would you like to see? And so I think that's promising in the grand scheme of things, and trying to hopefully get more counties on board with this so it becomes easier to recognize for people.
Mm-hmm. Very good. Yeah. Well done.
I mean, this makes me want to move to Porter County.
Yeah. Maybe you should.
Do you want something like this in my monthly report? Some of these or just updates, maybe?
I like it all personally. I like all the data.
Okay. I don't want to give you too much. Because
To me, there's no such.
Is a lot, but I can do something specifically for Find Help, or maybe give you some different. Like
You can do quarterly.
Yeah.
Have to be.
Okay. Okay.
Don't work yourself to death.
Yeah. Yeah. I don't want to create more.
Well, I don't want to give you more work either. So, all right.
Thank you guys so much.
Thank you.
Thank you.
It's exciting to see it from its inception to get to this point. Very good.
All right, so I will tick through these things very.
Thank you.
So we talked about health diversity and the current state budget, but I do want to give an update on grant funding. So, as you know, when we did the budget presentations, we do have a few CDC pass-through grants that will remain, and our immunization grant was partially funded with federal COVID pass-through funds. So that was pulled suddenly last week in the middle of our grant cycle, and we were told to cease using any of the funding and to submit it by Friday. And so we have done that, but we did just learn today that a portion of that funding was actually state funding. And so Chris just sent an email right before we came upstairs, but we think we're going to be able to recapture part of that, and we still will have that to spend whatever we spend of that by the end of June. So just kind of wanted to do an update on that.
So the federal portion pulled, but the state portion still exists.
That is what we were led to believe by the spreadsheet that got sent out.
Everything is kind of a work in progress.
It is. It is. And that
Head on a swivel.
brought up someone inquired, and so then they sent it out. So we're kind of waiting. We are going to get clarification on that because we obviously don't want to spend something that.
Can you explain to everyone, because I was confused by it, what this money can be used for? I think this use of it's COVID money makes it sound like we're using it for COVID vaccines, and that's not the case at all.
Correct.
So if you can explain what this money is.
So of course, and as you guys know, because you read a lot of, I'm sure, journal articles and things like that, what the pandemic brought to light were a lot of health disparities and access and outcomes and things like that. So a lot of funding is passed along to address those things in multitude of different ways. And so when we're talking about our immunization grant, a portion of it is what was granted to the state to be used through what they thought 2027 to further outreach, not just of immunizations, but of all different kinds. We just happen to get this portion of this money as a part of that grant to go out into the community and increase access of all required and recommended immunizations.
So it doesn't pay for the vaccines, but it pays for the support and programming of vaccines.
Absolutely. As a matter of fact, we are not allowed to purchase vaccine out of it. The only fund that we can purchase vaccine out of is, our Health First Indiana Fund. So our actual budget funding, so not our grant funding. So yes, so that is where we're at on that. This morning and all the last week, we didn't think that we had any of it. And fortunately for us, we had restructured the nursing department. We don't currently have part-time nurses doing that. And so it was.
Because a lot of health departments, this is how they fund their nursing.
Yes.
Was with these grants.
There were
Now
health
it's gone.
departments where people were called in the next immediately let go. So, so that is where that stands. Now, also last week we received requests that we apply for local area grants, and so I would just like to talk briefly about those and confirm that it would be okay if we pursue those. One of them, the HUB Coalition, so our Porter County Substance Abuse Council, they're renamed the HUB, contacted us, and they do grants each year to local organizations that are their partner organizations. And they actually asked us to apply on behalf of the Adolescent Supports and Knowledge Initiative that we are partnered with the Tobacco Coalition, actually the HUB, Juvenile Justice Services, and apply for that grant funding. So the maximum award for that in any category is $14,000. And they actually asked us to apply in the criminal justice or juvenile justice area. And so the idea is that we would support the things that we're currently doing already through Jamie out in the schools and juvenile justice services, other serving organizations, but also put on a symposium for empowering parents. And so it would be all about notifying parents of what their current risk factors are in our community, giving them ideas for skills for communication with their kiddos, and then also how they can provide protective factors. So how they can talk to their kids, how they can provide those protective factors. And so that's one of the grants that we would like to pursue.
This is what you're calling this a local grant.
Yeah.
Where does this funding originate from?
So I believe it is funding that HUB gets from CDC. Is it Lilly Fund? Okay.
So it's not government funded.
No. Well,
Sorry.
I thought it was CDC.
I caught you off guard. Well, you just keep hearing cut.
It's something that they currently have. So it's
Okay.
they're waiting on. This would be
Okay.
next year because we confirmed that as well. And
Yeah.
actually, their request for proposal came out with a really short turnaround time because of that.
Okay.
They were confirmed.
So they have the money on hand to.
Yeah.
Okay.
Yes.
I don't want to hold after we say yes.
That is one. The other one is a first things first opportunity. And Chris is working on that one right now, as well as one for Jimenez. So the first things first would be for Safe Sleep. So in partnership with sleep sacks, car seats, and those Roth ID tags that we discussed. And so the idea for that is we have a car seat safety grant, and we get car seats, but those car seats are convertible and booster seats, and they don't give infant car seats. And the reason is because the infants can technically go in the convertible seats, but as we all know, who have had infants or taken care of an infant, that's extremely difficult.
Yeah.
Bringing a brand new baby home.
For sure.
And so we do purchase car seats. It's a small budget item in Health First Indiana, but if we could request through this grant to get some car seats, then that would be, because we get referrals from the hospital.
Yeah, I know you go out there all the time. Yeah.
The hospital and actually do the bidding if that's what she needs to do and deliver the car seat, and then of course the Roth ID tag so that we can further that and make sure every car seat comes with one, and all of our birth bags, so the bags that they get when the kids are born as well. And we used to be able to get sleep sacks from the state, and that is something that we aren't able to get anymore, that we get a lot of requests for, and that we send home in all of those bags. So that is that grant. And then Geminis, we are starting safe sitter classes, and so it would help to provide materials for those classes and kits. So it's like a safe sitter kit that would include first aid in there. It would include activities, CPR masks, just a nice kit that we can give each of those sitters when they bring that home, and then also writing for funding for more elopement kits.
Okay, good.
So just kind of a way they love that. They've never heard of anything like that.
Good.
Excited when they went to the grant meeting.
Good.
If you guys would be okay, if you would like, I don't know if you need.
Do we need board approval to?
We just like to know that you guys are.
The board approval for you to reach out through these grants? Is that what the approval
So
is?
they're all grants that they've contacted us.
Oh,
okay. Just it's not something that we
need to
had historically done in the past.
Yeah.
Just like to make sure that you guys are aware, you're approving that we would pursue and take in these other funds. They are new funds that we have to go and create a new fund actually for them to be received into.
New line items in the budget.
Exactly.
Okay. So I guess, I think we would all be for this, but when we get to the point of creating a line item to the budget, if it comes through, then we approve the monies at that point in time, or do we vote today for all of this?
So it could be pretty fast. The turnaround on particularly the hub one is very quick, and so I think we would probably have to, if we were awarded that grant, maybe even go to the next commissioners meeting.
Good. Okay. So you'd want a board vote? Okay. So the proposal would be to approve the reaching out for these local grant services in regards to the hub. First things first, Geminis and immunization grants.
So just the hub, the first things first, and the Geminis grant.
Okay.
Just an update on our immunization.
Okay. So I make a motion for that. So.
Dr. Clifton?
Yes.
Dr. Brunt?
Yes.
Michelle?
Yes.
Robin?
Yes.
Sylvia?
Yes.
Dr. Ozan?
Yes.
Great. So you'll inform us when those come through, and with each of those, we'll have to present to, is it the council or the commissioners to get them?
So it would be the commissioners if it has to create a new fund.
Okay.
Go into a brand new fund, create a fund, that they have to do that with
Okay.
An ordinance.
Okay.
So unless they can go into an existing fund, and then it would definitely be the council to appropriate before we can spend.
Okay.
So thank you.
No, great.
Strong work. Oh, I'm sorry.
No, good work. That's great.
Yes. Thank you. Everybody who gets them and finds them and passes them.
Yeah.
Chris, lots of hard work. So in Allie, that works with us in the Tobacco Coalition for the HUB grant, she's really been working in anticipation for that. The turnaround's going to be so fast. It's like, we're going to be able to pursue this. We're going to need help. So just really appreciate everybody, all the hard work on that. For the Hope Wellness Portal, I know we talked portal. We were really excited. We got pricing, and then we had to say, okay, we're going to have to build our own portal. So since then, we met with IT, and then Lee has since come to me, and he just has not even been able to get started. So then Linda Passmore, who's from CWS, reached back, and also that's the portal developer, and they just were so excited because nothing like this, to their knowledge, has been done by a county, and they just really kind of want to be in on the groundbreaking. And so we really had a conversation, and she basically said, we will do it for what we can do it for and not lose money. So in the meantime, we have reached out to get some sponsorship. And so that is what we are hoping. We are hoping to get some sponsorship and be able to approach it that way.
Yeah.
I just want to make sure that that's okay with you guys. I don't know that we need to vote on that if we were able to get the sponsorship.
I think that's brilliant.
The portal.
Yeah.
Of course, be sponsored by them, us on the portal. I really feel strongly, and I absolutely understand not taking on the investment of what we were originally quoted. I absolutely feel strongly that this is the way to decrease the barriers to participation in the program, to get the most participation in the program, to get the best kickoff, to look our best, on that first day. We will kick off regardless if we have to collect papers and, hand enter. But this really helps us to do everything we want to do because we were really limited without use them, and we have the confidentiality coverage for people to be able to submit the information that they can submit for the doctor through the portal because it's HIPAA protected.
Oh, good.
Versus otherwise. And so if we have to do it ourselves, there are certain things we can't collect, right? So it will really help. But big shout out to Andreas and Allison, and Allison's here today. She's one of our public health interns.
Yeah.
And Madeline, who have been working on contacting people for those sponsorships.
Very good.
Thank you. And then the other quick update is Project Adam. And I'm forgetting if we talked about this last month at all, but I don't see that a lot of our schools have been achieving Project Adam Heart Safe School status. I don't know if you guys have seen
Chesterton
Schools, the most recent, I believe, right?
Did the Portage schools too? Portage, yeah.
Okay.
Yeah.
And so Crystal was looking into becoming a Heart Safe health department because she found that was a possibility and we would be the first health department in the state. But when she started looking into it, she was like, we can be the first Heart Safe community site outside of a Heart Safe county. And so we contacted the commissioners and said, hey, what do you guys think of this? The whole administration building would be a Heart Safe community site and receive that designation. And they were absolutely on board. So what has happened since then is that Tara, our American Heart Association, AmeriCorps Heart Corps individual who's stationed at the health department, has gone around. She has trained 200 Porter County employees in hands only CPR. We always say hands-free CPR on accident.
No,
CPR.
Yeah.
And then we're putting together a response team, and they will be trained in BLS CPR, both CPR and BLS. And then we are getting our AEDs moved to proper locations, our additional AED installed. And on Wednesday, June the 4th, Project Adam will be here, and we will have our exercise at 10 o'clock. So we're going to have a meeting that's going on, a public meeting in this room, and then we will have our exercise with our event, and our team will respond, and Project Adam will have to observe that, and at that time, it is the hope to grant the status. So that's Wednesday, June 4th, and of course we'll put out official invitations, but we wanted everybody to mark their calendar, and the plan is to walk downstairs and have a reception for our health department remodel. So,
Awesome.
We'll be all done and moved in and all of that. So, yeah, did anybody have anything to add to that?
I can't believe we would be the first county that would do something like this.
So LaPorte County is an actual Heart Safe county.
Okay.
So they're the first county to have Heart Safe status.
Okay.
And that is the goal.
Yeah.
Tim Stites for Valpo Fire is also working toward the goal. And so he has this great model where we all start in different areas and work out. So in Valpo, he has the Valpo Community Schools, Valparaiso University Community model. And so, knowing that is great. It's all about these partnerships and knowing that we can move to other areas of the county and do the same thing. And so, we can go into the schools, and I believe he does 6th grade in Valpo, and so maybe we adopt that same model and we go into Portage and Duplin and all the other schools and we hands-free CPR in 6th grade and we move out from there. So
very good. Okay.
I talked a lot. I'm very sorry.
No, you had good stuff. Really good stuff. All right. Any miscellaneous additions? Okay. And if there's any public comment. All right. I can have a motion to adjourn.
Amen.
Stick around here. I have no electricity.
Second.
I'm gonna sleep here.